Okay, so from the last class, we have been talking about the important surgical infections. One of the important surgical infection we need to talk is tetanus. So let's talk about this very important infection in today's class. Now see here, you all know you have studied from microbiology. Please mute yourself. You all know you have studied from microbiology what is the causative agent of tetanus. This is a bacteria which is known as Clostridium tetani. You can clearly see here. Okay, so Clostridium tetani is the causative agent of tetanus. This bacteria, okay, is a gram-positive bacteria. It is a gram-positive bacilli actually. Bacilli are also known as rod-shaped bacteria. This is a obligate anaerobe organism, means it will only survive in hypoxic environment. With oxygen, this bacteria is going to die. It cannot multiply or it cannot survive. And remember this can be used regarding the treatment of tetanus. Later on, we'll talk about that. Or even this type of therapy, which is known as hyperbaric oxygen therapy, sometimes can be used to treat anaerobic type of bacteria. It should be done quite early though. Okay, after the clinical tetanus occur, this hyperbaric therapy is not going to work. What I mean is, if we use that therapy, then bacteria can be killed at the site. Now let's come to the topic. The meaning of tetanus is, it is a Greek word. The meaning is to stretch, because this is a medical condition where there is prolonged contraction of skeletal muscles all over the body occurs. Prolonged contraction of skeletal muscle all over the body occurs, and this is caused by one of the toxin which is produced by Clostridium tetani, that is tetanosspasmin. Tetanosspasmin, this is the toxin which is responsible. So let me summarize again. If somebody asks you what is tetanus, you can answer in this way. This is a medical condition which is caused by anaerobic bacteria called as Clostridium tetani. It produces one powerful neurotoxin that is known as tetanosspasmin, and that is responsible for prolonged contraction of the skeletal muscles all over the body. Now look at this picture here. Now this is called Opisthotonus position. Opisthotonus position. Look at the arching of the back. Okay, it is like a bow shaped. Okay, bow shaped arching of the back. This is Opisthotonus position, and at the same time, look at the muscles all over the body. Okay, they are in contractile state. They are in contractile state. So all of you, whenever you join, okay, please mute yourself. Now let's talk a little bit about this organism, Clostridium tetani. Which type of wound is necessary for the infection to occur? Now see here. This is an anaerobic organism. So we all know anaerobic organism means they love hypoxic area or tissues. Dead and devitalized tissue are infected by this anaerobic organism. So very bad type of wound, for example road traffic accident, okay, with a little bit contaminated soil there. Okay, uh, now what happens, because of the very bad type of wound, there may be disturbance in blood supply, there may be some amount of muscle or soft tissue dead. So that is a perfect site, okay, for the proliferation of anaerobic organism like Clostridium tetani. Now you may be wondering from where the Clostridium tetani reaches there. It is not present there in the beginning. That is by contamination of the wound, because Clostridium tetani is present in the soil. So by contaminating wound, it will reach there. Okay, this is very important knowledge. Now let's come to the slide. Clostridium tetani, an organism that only flourishes in dead tissue. Okay? It only flourishes in the dead tissue and produces a powerful exotoxin. And the name of that exotoxin is called titanospasmin. Okay, titanospasmin. The name itself suggests titano, produced by Clostridium tetani. Spasmin is a spasm of the muscle. So this is the toxin which causes a spasm of the muscle. This toxin will pass to the central nervous system through, okay, through the nerves, through the motor nerve. There is retrograde, okay, transport of this toxin. We'll talk about that during pathogenesis. Right now, please listen carefully. So whenever there is toxin production at the site of the wound by Clostridium tetani, this toxin is absorbed into the nerve ending, and through the nerve it will go towards the central nervous system. This is the pathway. Now, what type of wound, okay, are commonly associated with tetanus? If that question is asked, the answer is very simple. For tetanus to occur, so let me highlight and show you this. This is an important point. Okay, underline actually. For tetanus to occur, an extensive injury which has received early and adequate wound toileting is far less at risk than a contaminated puncture wound which has been neglected. Now, let me clarify this. Now, there is extensive injury. For example, even the road traffic accident, okay, extensive type of injury. But the patient was taken quite early to the hospital. Very thorough wound cleaning was done, and some debridement was also done. Now, there is very less risk or less chance of developing tetanus, even if that wound is extensive. But at the same time, one type of small puncture wound, okay, one type of small puncture wound which was not cleaned properly, which was contaminated with the soil definitely, okay, or some rusty things there. Now, if it is neglected and not treated in time, it has a high chance of developing into tetanus. So, it is all about adequate wound cleaning at the time and debridement of the wound to prevent from tetanus to happen. If we neglect it, there is high chance. Okay, so let's move on. Now, infection generally occurs through wound contamination. Now, by this time, every student know this. If it is a very clean wound, which is not contaminated, there is no chance of having tetanus because the organism would not reach there. Okay, so wound contamination is very, very important point. Now, what type of wound? Okay. Puncture wound has a very high chance of developing into tetanus, puncture wound, rather than clean cut wound. Now, as the infection progresses, the muscle spasm develop in the jaw. That's why in many textbooks, it is also known as lock jaw. Okay? This lock jaw can be used as another term for tetanus disease. Lock jaw. Okay? Here. Okay? Lock jaw. Now, why the jaw is locked there? Means patient cannot even open it because of the contraction of masseter muscle. Now, masseter is one muscle or one type of muscle of mastication. Many students know this. Temporalis, okay, masseter, lateral pterygoid, and medial pterygoid. So when this masseter is contracting all the time, we cannot open the jaw. So this is called lock jaw. And elsewhere in the body, there is muscle spasm occur. And now, if I ask you where exactly in the body, you can very confidently answer the whole body, okay, whole body, especially on the back, okay, and even on the limbs. Even the neck muscles are stiff or spastic. Now, not everything is grave in tetanus. the infection can be prevented. Now there are two ways of prevention. One is proper immunization, okay, before that type of injury or wound contamination occur, and another is called post-exposure prophylaxis. Now, which immunization we give against tetanus? Yes, what is the name of immunization?
Sir, we can use B-type vaccine. Sir, we can use B-type vaccine, which is used for the cornicofacial diphtheria and tetanus toxin and acellular pertussis.
Exactly, is right. Okay, so I'm sure many students know this. Even if you don't know, no problem. I'll take this class in pediatrics. Okay, the immunization in children. So this is called DPT. Okay, DPT vaccine. Now D stands for diphtheria, P stands for pertussis, T stands for tetanus. So the same disease which we are talking now, tetanus. Okay. Now for diphtheria we use diphtheria toxoid. It is also a toxoid. For pertussis we use acellular pertussis vaccine. Okay, this is called acellular, okay, pertussis vaccine. It's here. And for tetanus also we use tetanus toxoid. So these are the three components of DPT vaccine which we have to give to every children, okay, every children in the respective time. Let's not go into the detail now. Now another one is post exposure prophylaxis. Now what do you mean by that? Anybody?
Sir, after infection, after injury, we can use some antibiotics.
Okay. Now see
So it
there.
means after infection, we give the immunization. So that is known as post-exposure prophylaxis.
Okay, now see there. Now both of them, okay, are very near to the correct explanation there. Okay, now see there. Let me a little bit modify the answer. Then it would be nice. Now this patient did not have any previous immunization. This is important one. If previous immunization was given, there is very less chance of tetanus. Okay, so this is always there. Now think about a situation where this patient did not have prior immunization with tetanus toxoid. On top of that, he has very bad type of injury or wound which is contaminated. Now after that happens, okay, after that injury or wound happens, we have to give certain thing so that the disease will not occur. This is called post exposure prophylaxis, and there are so many different things we have. One is called passive immunization. Passive immunization is given for this regard. Okay, passive immunization means, what do you mean by that? Just give me one word regarding the answer. What is passive immunization? What type of thing you give to the patient?
Sir, it's mean
Antibodies are given. Antibodies are given to patient.
Exactly. Okay, so these are antibody. So that's why I said one word answer. That's enough. Antibody. So prior form antibody are given to the patient. Now this is called passive immunization. Never forget this. Active immunization means we give something else like antigen, okay, like whole cell from that organism probably, or some surface antigen, okay, some purified form of antigen, something like that. This is active type of immunization. Passive, preformed antibody are injected to the patient after the exposure. This is one way. Another one, okay, is antibody. Sorry, the antibiotics, I should say. Antibody we just talked about. Antibiotic. For example, after the exposure, if we treat the patient in time, okay, this is one of the component of post-exposure prophylaxis as well. Now see there, all of you, please have a look at this slide. This is a highly informative one. Okay, so take a bit of time. All of you, please have a look there. Okay, so let me explain this to you. Now we have already defined what is tetanus. Okay, this is a disease which is caused by Clostridium tetani by producing one powerful neurotoxin, and that neurotoxin is responsible for spasm of the muscle all over the body. Now see there, this is how usually the wound occurs. So this is a puncture wound, a puncture type of wound, which is very commonly associated with tetanus, because there may be a lot of bacteria associated with this type of substance. Now this puncture wound will drive, okay, the bacteria deep inside the tissue, and they can multiply there if there is favorable environment. That favorable environment is hypoxic environment. You should never forget that. Now after they multiply, they release one neurotoxin which is called tetanospasmin. At that time wound may be already healed or wound may be fresh. Okay, so incubation period is very variable here. Now after this neurotoxin is produced, this neurotoxin, okay, reaches the axon terminal. Okay, it is absorbed there and it is carried by the axon towards the central nervous system. It is carried towards the central nervous system. Now this is called retrograde transmission. Retrograde. Okay, so the motor neurons, they start from the central nervous system and come towards the periphery. But here the bacteria, especially the toxin, I should say, the toxin, it has started from the periphery and going towards the central nervous system. So this is retrograde transmission. Okay, now when it reaches the central nervous system, it will block, okay, the release of inhibitory neurotransmitter. It will block the release of inhibitory neurotransmitter like glycine and GABA. If those inhibitory neurotransmitters are blocked, then we only have excitatory neurotransmitter, and that excitatory neurotransmitter will only cause excitation of the muscle, and that is contraction of the muscle. So this is the main mechanism of muscle contraction in case of tetanus. Now let me repeat again, because this point would be repeated so many times in today's class. So what this toxin is going to do, tetanospasmin, it will block the release of inhibitory neurotransmitter. They are glycine and GABA. GABA is gamma amino butyric acid. So when those inhibitory neurotransmitters are blocked, only excitatory neurotransmitter will take over, which leads to uncontrolled spasm or contraction of the muscle everywhere in the body. This is the one. So in the face, okay, one clinical feature is shown in the face here, which is called rhizus sardonicus. This rhizus sardonicus means smiling type of face. Okay. Now, why this face looks smiling? Because of abnormal contraction of the facial muscle, one of the important manifestation of tetanus. Okay, so many other manifestations would be there, which we'll talk in our clinical features. Okay, now see here. Now before we move on to the clinical features or the proper pathogenesis, once again revise a little bit about this bacteria. What are the characteristic features of this bacteria? See there, and look at the picture also. So this bacteria is a gram-positive bacilli. Gram-positive bacilli or gram-positive rod. It is a spore-forming type of anaerobic organism. It forms the spore. You can clearly see here. This is the spore. See here. Okay, this bulb structure is the spore. They are strictly anaerobic organism. They cannot survive in oxygenated environment, and they produce tetanospasmin. There is one more toxin which is known as tetanolysin also, but tetanolysin is not very important in comparison to tetanospasmin regarding the clinical features. Now, where these organisms are commonly found, or what is the reservoir? That is soil. So any wound that is contaminated with the soil, and if it is not cleaned in time, there is a chance of tetanus if that person was not previously immunized. Always at that point at the end, okay? If we are properly immunized, if we have taken all the doses of tetanus toxoid, then we are immune. Now, related to the transmission, the puncture wound and the trauma are responsible. We already talked about that. Now, one small questions for you, okay? Please listen carefully. Is this disease transmitted from one person to the other or not?
No, sir.
No, sir.
No, sir.
Very
No,
good.
sir.
Very good. So almost all the students know this answer. No, the answer is no. Okay, there is no person to person transmission at all. Okay, so this disease, okay, cannot be probably, we cannot completely eradicate this problem. Okay. For the eradication of this problem, probably we need to vaccinate 100% of the people all over the world, and that is almost impossible. Okay, that is always impossible. So we have to properly educate them. What is the way that the people are getting tetanus? So if they avoid that, then the disease can be prevented. Now let's talk about the important part of today's class, which is etiopathogenesis. Now some of the important information I've already shared with you. Okay, now see here. Now, after the bacteria enter into that tissue or that injury site, they germinate there. Okay, they germinate there. Now, germination means they are having spore. When the vegetative form of the bacteria comes out of the spore, this is called germination. Now, vegetative form of the bacteria or the active form of the bacteria comes out from the spore, that is germination. After that happens, they produce the toxin, okay, and this is called tetanospasmin. Now, this tetanospasmin is produced in the local site, isn't it? For example, if the local site is in the foot area, so it is produced there now. If it is in the hand, it is produced there. If it is in the face, it is produced there. Now, that toxin has to be carried to the central nervous system, and that is done by the axons. So they are carried intra-axonally to the central nervous system. This is called retrograde transmission. Okay, retrograde, in the opposite direction. Now, when they reach, okay, to the central nervous system, they binds to ganglioside receptors there, and after that they blocks the release of inhibitory neurotransmitter, or you can also call that mediator, like glycine and GABA. Glycine and GABA are the important types of inhibitory neurotransmitter in our central nervous system. Now, even if I want to divide them, glycine is mainly present in the spinal synapses, and GABA is mainly present inside the brain. Glycine mainly in the spinal cord, and GABA mainly in the brain. Now, what is the full form of the GABA? Every student know that. Yes?
Gamma amino butyric acid.
Acid.
Very good. Okay, so I don't need to write it here, then student know that already. Gamma amino butyric acid. Gamma amino butyric acid is called GABA. Let's move on. Now, if the inhibitory neurotransmitters are blocked, then only the excitatory neurotransmitters, okay, are left behind, and they lead to unopposed muscle spasm. Inside our nervous system, there should be a balance. There should be a balance between these different type of neurotransmitter, inhibitory and excitatory. Now, the examples of excitatory neurotransmitters are, anyone?
Epinephrine and norepinephrine, sir.
Okay, anything else? Any other? Now, I accept I accept that answer, epinephrine and norepinephrine, but remember, regarding the muscles, acetylcholine is far more important than epinephrine and norepinephrine. So it's acetylcholine, number one, then another, okay, are inside the brain again, like glutamate, aspartate, they are another type of excitatory neurotransmitter. Glutamate, aspartate, okay, acetylcholine, these are the examples. Now only muscle stimulation, okay, or excitation occur, and that is the reason for uncontrolled spasm all over the body. This titanospasmin is one of the most toxic substances known. It is a very powerful exotoxin. I'm sure students know the difference between exotoxin and endotoxin. Okay, so I want to ask this question to few of the students. Please answer one by one. Okay, what is endotoxin and what is exotoxin? How I define them? Anybody? If it is
Yes,
confusion, okay. Yes, Irfan.
sir, endotoxin is only present in gram-negative bacteria, and exotoxin present in both gram-negative and gram-positive.
Okay, good, good. So that
And
anybody else, please? Yeah.
So exotoxin are the toxin which produce when the bacteria is alive, and endotoxin produce when the bacteria is dead, like this.
Very
Okay,
good,
that's
Abbas. Abbas, good, good. Yes. Anybody else? Okay. So let me combine all these answers together. Exotoxin.
exotoxin are heat labile, but endotoxin are sir, heat stable lipopolysaccharide protein.
Okay. Okay. Now that is also correct answer. Now listen carefully, all of you. There's so many students. Probably some of them they don't know the answer. So listen. Okay. Now, endotoxin is produced by gram-negative organisms. Absolutely correct. Only gram-negatives they produce endotoxin, and the chemical structure of endotoxin is lipopolysaccharide (LPS). Lipopolysaccharide (LPS) means endotoxin produced by gram-negatives. Okay, but exotoxin can be produced by both gram-positive as well as gram-negative organism, and it is produced by living organism. Means they are still proliferating there, they're still surviving there, they're actively multiplying, and during that time only they can release exotoxin. But endotoxins, okay, they are mainly produced after the disintegration of the bacteria. And one is heat labile, is absolutely right. Exotoxins are heat labile, they may be destroyed or modified with the application of the heat, and endotoxins they are not. So there are few more differences, but these are the question which we love to ask to our student, because you already discussed this during microbiology class. Let's move on now. Now see here. Now these toxins, they act at several sites within the central nervous system, including peripheral motor end plate, spinal cord, and the brain itself, as well as sympathetic nervous system, leading to a lot of clinical feature, which we are going to discuss under clinical feature heading. Now, how the recovery occurs? The recovery of the function depends on the sprouting of new axonal terminals. So some of the patient, if we treat them well or treat them in time, they can recover well. Okay, so it depends on the situation. Let's move on now. So quickly, let's revise again what we discussed till now regarding the pathogenesis. Now see here, Clostridium tetani is the causative organism. This organism produces titanospasmin. So titanospasmin, this is a powerful neurotoxin. This titanospasmin, okay, is carried by, okay, the nerve, that is axons of the nerve till the synapses. Now there it blocks the release of inhibitory neurotransmitter So only excitatory neurotransmitter is left behind, which can cause uncontrolled muscle spasm. Never forget this. See here, there is continuous stimulation by excitatory neurotransmitter, and inhibitory neurotransmitter release is blocked. Okay, so there is a clear-cut imbalance. This is the pathogenesis of tetanus. Now, the clinical feature would be very easy for you. Okay, it is very, very easy. All of you, please see there. The incubation period is highly variable. It is from 24 hours to 24 days. 24 hours means just one day to 24 days. So what does that mean? What is the incubation period? Yes? What is
Sir,
incubation?
incubation period means a duration in which the pathogens cause disease.
Okay, good, good. Anybody else? Very good answer. Anybody?
The incubation period is period in which the organism shows signs and symptoms in the body.
Okay, good. Harish? Yes, yes.
The
Okay.
period between exposure to an infection and first symptom.
Fine, Adnan, good. Now listen, all of you please, I cannot ask the question to
The
every
symptom
student.
of the toxin, sir.
Okay, first symptom of the,
Infection.
okay. Now see here, now you understand like this, organism enter into the body, okay, and then there is a time gap between the entry of organism and manifestation of sign and symptom. This is called incubation period. For example, I was exposed to the organism today, but I did not develop any sign and symptom till, okay, for example, tomorrow or maybe after 5 days. So there is a gap, some gap between the entry of organism and presentation of sign and symptom. This is called incubation period. So it is highly variable here, 24 hours to 24 days. You may be wondering why this high variability. Now the answer is a bit tricky here. It depends on the site. If the wound occurs a bit nearer to the central nervous system, incubation period may be quite less. If it is far away from the central nervous system, the incubation period may be longer. This is one explanation. And another one, it depends on what is the dose of the organism as well. What is the dose? If a lot of bacteria enter into the wound, okay, and if they multiply rapidly, then probably the incubation period will be shorter. Let's move on. Now, muscle spasm first develops at the site of inoculation, means the area of trauma, and then it involves the facial muscle and the muscles of the neck and the spine. This what happens in case of tetanus. Sometimes different textbook mention this as a local tetanus. Local means at that site, you know, where the injury occurs, probably because of the tetanus spasmin, the contraction or the spasm occurs in that site in the beginning. This is called local tetanus. Then after it enters the central nervous system, the respected muscles would be affected. Now classically, the patient exhibit these clinical features. So please pay attention here. Trismus. Trismus is the term for lockjaw. This is the medical term for lockjaw. And this lockjaw occurs due to masseter muscle spasm. I already explained this to you. Masseter is responsible for opening the mandible or opening the jaw. Now, if masseter muscle is constantly under spasm, then we cannot open the jaw. This is called lockjaw. Now, if this patient needs intubation, intubation means putting a tube into the trachea. Sometimes what happens, the airway is compromised. Okay, so we need to protect the airway by putting a tube inside. Now, in tetanus, this intubation is a very, very challenging process because of this lockjaw phenomena. We need to give good muscle relaxant then only intubation can be done. Remember this. Another important clinical feature is rhizus sardonicus. This is called smiling faces or smiling face. This characteristic grinning type of face occurs due to spasm of facial muscle. So don't forget, rhizus sardonicus. This is not a true smile, okay? It looks like patient is smiling, but not a true smile because it is caused by spasm of the facial muscle, and that is done by the toxin. Patient is not happy there. It is done by toxins. Another important clinical feature is Opisthotonus. It's an arched body. The body looks like a bow, okay? Tremendously arched back, like a bow shape. So this is Opisthotonus position, and in this position there is hyperextended neck. Now, I'm not sure whether you have studied this in forensic medicine or not. There is a toxin. There is another toxin which can also lead to Opisthotonus position. Anybody can tell me what is the name of that toxin?
Such strychnine poisoning, strychnine.
Very good. It's strychnine poisoning. Excellent. Okay. So strychnine, or you can also call that strychnine, whatever you want to say. Strychnine or strychnine poisoning also leads to Opisthotonus type of deformity. So that may be an important MCQ question for you in the exam. So let me write that. Many students probably they don't know what is the answer. Strychnine, strychnine poisoning. Okay, strychnine poisoning. Okay, so this is the one. Don't forget, these are the important MCQ questions for you in different exams. Now, in this condition, the esophagus also get spastic. There's a spasm of the esophagus, and because of that, okay, because the esophageal spasm, the person cannot swallow the food, leading to dysphagia. Dysphagia, okay, is difficulty to swallow the food. One of the important feature of tetanus. In a disease known as rabies, also there is severe esophageal spasm leading to dysphagia. That is much more serious type of esophageal spasm than in tetanus. We will talk about that rabies somewhere else, not in surgery. Now, regarding the autonomic dysfunction, the patient may be having tachycardia, labile blood pressure, means fluctuating blood pressure. It may be high, it may go low also, sweating, and cardiac arrhythmia. All of these are function of sympathetic nervous system. So sympathetic nerves may be affected by tetanus. So this autonomic dysfunction feature may be seen. Let's move on. Now, the same patient may be having neck rigidity. Okay, neck rigidity means stiffness of the neck. Now, there are so many other differential diagnoses of this neck rigidity, or I can say the causes of neck rigidity. So many are there. Meningitis, meningoencephalitis, okay, subarachnoid hemorrhage. All of these can lead to neck rigidity, which are very different conditions than tetanus. So if your examiner or your professor asks you what are the causes of neck rigidity, you can quickly tell these answers: meningitis, meningoencephalitis, subarachnoid hemorrhage, tetanus, and sometimes even some local diseases in the head and neck area like tonsillitis, upper lobe pneumonia, okay, any abscess, okay, or any injury of the cervical muscle that can also result in neck rigidity. They are less important in comparison to the other which I just told you. Now, there is spasm and rigidity of all muscles everywhere in the body. Even the limb muscles would be affected. If I examine the reflexes, there will be hyperreflexia. I mean, they are more brisk than the normal. They are more brisk than the normal. Hyper exaggeration or hyperreflexia. One very important feature is there is tonic-clonic convulsion occurs on the body. Now, this is a type of seizure disorder, okay, tonic-clonic convulsion. Now, see here. Convulsion is a motor type of seizure. So there is a spasm of the muscle going on. And in tonic-clonic seizure, a person becomes very rigid in the beginning, and the person starts to shake the muscle vigorously. So tonic, okay, tone means the person's muscle become rigid. Understand like that? Clonic means there is repeated flexion and contraction, flexion and extension, I should say, of the muscle. So there is movement or shaking of the muscle. Tonic clonic seizure, also known as grand mal seizure. Grand mal seizure. Okay, this is a synonym. Now, he doesn't have any control over the body function in this type of condition. So these are the different clinical features of tetanus. See that sometimes the person may die from aspiration pneumonia, respiratory failure, cardiac failure, or exhaustion. Now, death may result from aspiration. This is caused by aspiration pneumonia, very commonly happening in case of tetanus. Respiratory failure can occur, cardiac failure can occur, and even exhaustion, severe exhaustion can lead to, a damage of the skeletal muscles. The content of the skeletal muscle called myoglobin may be released on the circulation. That myoglobin may go towards the kidney tubules. It may lead to acute renal failure, and that may kill the patient as well. So different types of mechanisms are there. Some of the poor prognostic signs in case of tetanus are given below. So let's discuss about them. See here. Whenever there is short incubation period, that is less than 5 days, okay, there is poor prognosis. Now, I already told you, short incubation period occurs if the trauma or the wound occurs quite near to the central nervous system. So there is a less time needed for the entry of that toxin into the nervous system. That's why the incubation period is short. That's why all the signs and symptoms will come quite early. This is a poor prognostic sign. Convulsion, which occur within 48 hours of the onset of muscle spasm, is a poor prognostic sign. If a postpartum lady develops tetanus, this is poor prognostic sign. We all know what is postpartum, isn't it? What is postpartum?
Sir, it's after delivery.
After labor.
After delivery, sir, like, sir, immediately after birth or something.
Exactly, you can say after delivery. Okay, fine, you can say after delivery or after giving birth to the baby. Okay, but some of the examiners will be particular till what time. You mention 6 weeks from the birth of the baby till 6-week period is called postpartum period in that lady. It's not called postpartum period for the baby. Please remember that for that lady it's a postpartum period. And another one occurring in the neonate or elderly people also, there is a poor prognostic sign. Neonatal tetanus still can occur or occurring over the world. Okay, neonatal tetanus, if that pregnant lady did not take any tetanus toxoid, okay, during pregnancy, then the newborn may suffer from tetanus, especially if the umbilical cord was cut with unsterilized instrument. Means if there is a contamination of the umbilical cord by the spore of Clostridium tetani bacilli, okay, and if the mother was not immunized properly, then the newborn may get neonatal tetanus, and the prognosis is very, very poor. Now, let's talk about what are the investigation we like to do in a case of tetanus. Do we need any investigation or not? The answer is no. This is purely a clinical diagnosis. I don't need any investigation. If I see this type of features like lock jaw, okay, Rhizus sardonicus, hyperextended neck and back, just like a bow-like appearance, which is called Opisthotonus position. There is a feature of dysphagia. Some autonomic dysfunctions are there. Okay. If I combine all these things together and take a history about any type of wound, okay, few days ago, this is clear-cut case of tetanus in 100% of the time. But still, okay, we can do certain things. Now, one of that is spatula test. Spatula test. Now, what do you mean by that? Let's talk about it. This spatula test, okay, is putting a spatula inside the oral cavity and trying to touch the posterior pharyngeal wall. In a normal person who is not having any tetanus, the gag reflex will be initiated if we do that. Okay, it is called gag reflex. This is normal, but in a person with tetanus, there is reflex spasm of the masseter muscle. Okay, and this leads to biting of the spatula by that patient. So let me repeat again. If we do a spatula test in a tetanus patient, the patient will bite the spatula. Probably I cannot put that spatula on the posterior pharyngeal wall. So think about how difficult it would be to intubate this patient if it is needed. This is really a difficult task. There is virtually no value of the lab test in case of tetanus. Okay, but one lab test, okay, I can think of here is, remember, if there is prolonged contraction of the skeletal muscles for few hours probably, that can lead to severe damage of the skeletal muscle, and there will be release of intra-muscle content into the blood. One of that content is potassium. Another content, okay, another type of content there is myoglobin. Okay, myoglobin. So potassium and myoglobin can become high, and that myoglobin is leading to acute renal failure. So how we diagnose acute renal failure with the help of lab test? Which lab tests are necessary in the diagnosis of renal failure? Can you answer me?
Creatinine level.
Creatinine level.
Exactly. Urea and creatinine level. Very good. Blood urea and serum creatinine level. Another is potassium level and some other electrolyte. So see that this is how you can correlate with the lab test. Now, full blood count and biochemistry, if done, are normal, and there is no abnormality revealed on the imaging of the head and spine. If we do CT scan or MRI scan, it would be normal. It is not necessary also. Now, look at this spatula test here. This is a baby, okay, probably a case of neonatal tetanus. We try to insert the spatula inside the oral cavity, but we are unable to do so because of the severe spasm of the masseter muscle. The jaw is locked. Okay, so this is a very important type of test, a clinical test. Can you see how the fingers are here in this baby? See that the fingers are locked. This is the spasm. This is because of the spasm of the muscle. So these are some of the important features which we can see quickly here. Now, the last part is the management, and very important part of this class. So how to manage this disease. Now we have divided this management into different headings. The first of them is a suspected tetanus. Suspected. Okay. Now what we are going to do here? The first thing always is a wound toileting. Wound toileting means cleaning the wound thoroughly or properly. Now, after that person gets injury or wound, the first thing the person needs to do is proper cleaning of the wound. Okay, and the cleaning of the wound can be done by tap water. Okay, a bit of soap and water, and if it is a crushed type of wound, very bad type of wound, a lot of tissues are damaged there, then the person must go to the hospital for the debridement. Okay, debridement. Now see here, the single most important step in preventing tetanus infection is good wound cleaning. So good wound cleaning with debridement of dead tissue to remove the source of toxin. Very, very important. It has to be done as soon as possible. We don't wait for this. So this is called debridement. Debridement means you remove whatever the dead and devitalized tissues are there. Another concept is vaccination. Now see there are two types of vaccination we can give. Tetanus toxoid is an example of active vaccination or immunization, and tetanus immunoglobulin is the passive one. So both active as well as passive immunization can be given. So this tetanus toxoid is given intramuscular. Okay, it is given intramuscular, and in the adult we usually give this on the deltoid muscle, and in case of very small baby it is given on the thigh area. If the patient is already protected, a single booster dose of the tetanus toxoid is given. Otherwise, the full 5-dose course of the vaccine should be given. Now, let me clarify this, okay? We'll come for this discussion a bit later also. Now, who are protected against the tetanus? Now, remember how many doses we give, okay, regarding the DPT in the primary vaccination schedule. How many doses we give? Anybody? How many doses we give regarding the DPT vaccines? So there are 3 doses. Okay, so probably we have not taught you this, so please see here 3 doses. So we give in 6 week the first dose, 10 week the second dose, and 14 week the third dose. These are the 3 doses of DPT, okay, and TT is a part of DPT, right? So 3 doses, many children or babies they already got. Now this is the 3 primary doses we say. Now some booster doses are also necessary, and that is usually given when the baby reaches 18 months of the age, and another dose is given when the baby is started to going to school at 5 to 6 years. So there are 5 doses of tetanus toxoid which is necessary, okay, for anybody or any person. That's why the full 5-dose course is mentioned there. Now we are going to talk about this a bit later. If the person has not completed this vaccination series before, for example, they have just taken 3 doses before and it is already crossing 10 years or already crossing 5 years, or sometime they have never taken any TT before, what are we going to do? So this class is all about that. Okay, we'll talk about that a bit later. Now another type of vaccination is tetanus immunoglobulin. This is the passive type of immunization. Around 250 to 500 units of tetanus immunoglobulin, which may be human tetanus immunoglobulin, can be given intramuscular, and a bit of dose can be given around the wound area as well. So a bit of that can be given around the wound area also. Now, in case of established tetanus, what are we going to do? Established tetanus means there are signs and symptoms already present. So the management is supportive, medical and nursing care. Okay, very, very important point. Supportive management play a big role whether this patient is going to survive or dead. And this supportive care, let me talk about this. For example, the persons cannot breathe properly. Okay, the person cannot breathe properly. There is compromise in his airway. The person needs to be admitted in the intensive care unit and probably kept in ventilator. If the person's constantly getting seizure, we need to give, okay, anti-epileptic drug, for example benzodiazepines, or probably some long-acting anti-epileptic drug also. If the person cannot swallow the food, we have to give food by some other way. Okay, if the person is hypoxic, we need to give oxygen. So all these are called supportive management. Very, very important one. So wound toileting or wound cleaning, okay, comes here also. Wound toileting or wound cleaning. Then vaccination. Now regarding this vaccination, there are again two types of vaccine which are mentioned. Human tetanus immunoglobulin, which is a passive immunization, and this is very fast, rapidly acting. So we need to give this all the time. And tetanus toxoid also can be given. But one important point here is this human tetanus immunoglobulin will only neutralize the circulating toxin. Once this toxin is fixed onto the central nervous system tissue, this tetanus immunoglobulin will be useless. So let me repeat again. It will only neutralize the circulating toxin on the system. Once it is fixed onto the nervous system, now we cannot neutralize that toxin anymore with the help of immunoglobulin. But still we give, because we still believe there are some proliferation going on somewhere and some bacteria are still releasing the toxin. So to neutralize that toxin, we still need to give. Another important management is antibiotic. Remember, this disease is caused by bacteria. So antibiotics has to be given. And any type of antibiotic you can give among this list, like metronidazole or penicillin. Both are equally commonly used. Metronidazole or penicillin. This is anaerobic organism, so metronidazole is an important drug, and many of the textbooks it is also written as a drug of choice. But penicillin and cephalosporins are also effective. Okay, so let's move on. What are the other types of management? See there, that supportive care, okay, which I mentioned a little bit before. Okay, some more points are here. The patients are nursed in a quiet, isolated, well ventilated and darkened room. So patients are nursed in a quiet, there should not be any unnecessary noise, okay, well ventilated and darkened room. Okay, it is a little bit similar to the management of rabies here. If unnecessary stimulation, okay, are there, then probably that can lead to seizure. So we need to be careful. Now another important drug which we give for the control of muscle spasm is benzodiazepine. So can you give me few of the examples of benzodiazepine, please?
So diazepam,
Oxazepam.
Good. So see there, so many students are really confident regarding these examples. Benzodiazepines, diazepam, lorazepam, nitrazepam, oxazepam, and those type of drug. Even chlordiazepoxide, okay. Diazepam, okay, lorazepam, nitrazepam, oxazepam, chlordiazepoxide, even alprazolam. These all are benzodiazepine. Now these benzodiazepines have so many uses in clinical medicine. They are classified under hypnotics drug, sedatives and hypnotic drug, but they are also used in the control of seizure disorder. Okay, if any ongoing seizure is there, the first drug we give is benzodiazepine. Now in this case we are talking tetanus now, so let's focus our attention here. To control the muscle spasm in case of tetanus, to sedate the patient, and if some seizures are going on, to control that seizure also, benzodiazepines are very commonly used. Now there is one important adverse effect of benzodiazepine if we give it in overdose. Okay, what is that adverse effect? Respiratory depression.
Respiratory depression.
Exactly, respiratory depression. But you don't need to care, you don't need to worry actually, because the patient is in hospital. If respiratory depression occur and if the patient cannot breathe, we have ventilator there. Okay, we can quickly go for intubation, though it is difficult, but there are experienced people in the hospital. There are anesthesiologists there who are very experienced in intubating this type of people, so we don't need to worry. Okay, just give enough dose of benzodiazepine to control the muscle spasm and further sedation. Now alternatively, we can go for phenobarbital or even chlorpromazine. These are alternative drugs. As far as possible, don't mix this drug together. If we mix, there is a high chance of respiratory depression. Now, another important point, if the airway is compromised, means if the airway is blocked, if there is severe spasm of the larynx, okay, intubation has to be done. Intubation means putting an endotracheal tube inside the trachea and fixing it. After that, we have to connect that endotracheal tube to the mechanical ventilator. One other drug which we can try is magnesium sulfate. This magnesium sulfate infusion decreases the need for antispasmodic and tetanus associated autonomic dysfunction, so it can be tried. Now one small information for you, magnesium sulfate is also given in the control of one of the condition in obstetrics, that is called eclampsia. Eclampsia is pregnancy induced hypertension with seizure disorder. So during that time also magnesium sulfate can be given for the treatment. Let's move on. Now, what are the common tetanus complications? So all of you please focus on the screen now. Have a look there. So these are the tetanus complication. Laryngospasm, spasm of the larynx. It can kill the patient if we have not protected the airway. Fractures. The spasm of the muscles are so strong that some of the bone can be fractured. So you can understand now how strong the contraction are. Hypertension, because of autonomic dysfunction, we already talked about, even hypotension can be there. Nosocomial infection, because the patient may be present or may be admitted in the hospital in the intensive care unit for a long time, and nosocomial infection is very common in that setting. Nosocomial infection means hospital acquired infection. This is very difficult to treat because drug resistance organisms may be there. Pulmonary embolism, this is because of deep vein thrombosis. The thrombus may get detached and reach the pulmonary artery. Aspiration pneumonia, and the person has a high chance of death after clinical tetanus. Now another point I like to highlight here is there is no alteration in consciousness level. Please listen carefully. There is no alteration in consciousness level in the patient. So because of this, patient can feel all the pain of this vigorous muscle contraction in case of tetanus. So this is one of the most painful type of condition a patient can have. Even if the patient die because of this, this is one of the most painful death. So to protect the patient from this very painful experience, give a very liberal dose of benzodiazepine. And along with that, you can give some other painkiller also, like opioid analgesics. But once I relax the muscle by giving benzodiazepine, there will be no pain, so there's no need of giving other analgesics after that. Now we have come toward the end part of this topic. What are the tetanus prone wound, and what do you mean by tetanus prophylaxis? Let's talk about this. In the other way, which type of wound are called tetanus prone wound, or there is high chance of development of tetanus after that, and what we are going to do. See here, tetanus prone wound is defined as any wound or burn sustained more than 6 hours before surgical treatment of the wound or burn. So a lot of time is already there before we started the treatment. There's a lot of time lag after the injury and before the treatment is started. So that is more than 6 hours. Even the bones, okay, can have those bacteria contaminated there. Any wound or bone at any interval after injury that shows one or more of the following characteristic point, and these are a significant degree of devitalized tissue. Devitalized tissue means they are not surviving tissue, okay, they are already dead tissue there. They lose their blood supply, so they are going to die very soon. So this is called dead and devitalized tissue. Puncture type of wound has a very high risk, okay, because these wounds are very deep inside. Contact with soil or manure likely to harbor tetanus organism, okay, and clinical evidence of sepsis in that wound already. So these are high risk wound which can develop into tetanus. So let me repeat a bit again. The important ones are devitalized tissue and puncture type of wound. And if they are contaminated with soil or manure, there is very high chance. And if the duration is longer, there is increased chance. Now, what is that tetanus prophylaxis? All patient with traumatic wound, okay, all patient with the traumatic wound should be assessed for the need for TIG or TT. This is tetanus immunoglobulin. It's a passive type of immunization, and TT is a tetanus toxoid, is the active one. Okay, so should be assessed for the need for TIG or TT. What is that need? Do they need it or not? So we need to be quite sure about it first. Now see there, the immunization of tetanus after an injury can be done with TIG, a tetanus immunoglobulin, which provides passive, temporary, and immediate immunity, or TT, which provides active, prolonged, but delayed immunity. TT takes time for the production or generation of antibody because it is an active type of immunization, whereas TIG is a passive, it's a preformed antibody which we are giving. So this is a quick in action. But we still have not discussed what are those indications. So let's talk about this. Okay, this is the way by which this TT is given. Okay, this in the deltoid area. Now, all of you, please focus on this slide. Okay, this will provide all your answer here. The current recommendations of tetanus toxoid or tetanus immunoglobulin are as follows. Now, this is a history of tetanus immunization. Okay, this is clean wound and this is dirty looking wound or contaminated wound. So if 3 doses of tetanus toxoids are not taken in the past, or if the patient has taken less than 3 doses of TT in the past, and when the person comes to the hospital with clean wound, like a clean cut wound, okay, we need TT, but TIG is not necessary because he has not taken 3 doses of tetanus. So TT is given, but there is no need of tetanus immunoglobulin. This is the important point. What about the dirty looking wound now? The same condition. If the patient has not taken 3 doses of tetanus toxoid in the past, still TT is given, and tetanus immunoglobulin is also given because there is a high chance of having tetanus because the wound is dirty or contaminated. Now let's talk about another scenario. If the patient has already taken, okay, 3 or more than 3 tetanus toxoid in the past, if he comes with clean wound, okay, TT is given only if the last dose is taken more than 10 years ago. TT is only given if the tetanus toxoid is taken more than 10 years ago in the past. Whereas there is no need of TIG now because it is a clean wound. Whereas in the dirty looking wound, tetanus toxoid is given if the patient has taken the last dose 5 years ago. See that? Because of the dirty looking wound, the duration is decreased now, and there is no need of TIG here because the patient has already taken 3 doses of tetanus toxoid. TIG is still not necessary. So revise this table many times and make a good concept out of it. Okay, probably hearing 1 or 2 times may not be enough here. Now, this is okay a similar type of discussion here. This table is also we should give a little bit time to understand here. See this. This is the primary course of vaccination. Okay, 3 doses. I already told you. These 3 doses are given at 6 week, 10 week, and 14th week of life in case of baby, and these are part of DPT vaccine: diphtheria, tetanus, and acellular pertussis. So 3 doses of the vaccines are given 1 month apart. This is important point. Now, 4th dose is given at least 3 years after the primary course, usually preschool entry. This is a little bit different in different countries. Okay, some wants to give at 16 to 18 month also. Some say when the baby start to go to school, then next dose would be given. So a little bit variable. Now, individuals who are aged 10 years and over, we have only had 3 doses of a tetanus containing vaccine, with the last dose at least 5 years ago, should receive the first tetanus booster now. Okay. So this is important point. So if five years have already passed and the wound is a bit of dirty looking wound, then during that time, don't think anything else, give 1 shot of TT. The 5th dose is given at 13 to 18 years, okay, in case of primary vaccination. The second booster dose should be given to all individual, ideally 10 years after the first booster dose. So once 10 years have passed, okay, after that booster dose, then another 5th dose is given. So let me summarize this. A little bit confusing for the student, I know that. So in anybody's life or throughout the lifetime, if we have taken 5 doses of tetanus toxoid, we are safe. We are quite safe. Probably we don't need to worry anything. But many of us, we don't take that tetanus toxoid just like it, isn't it? If there is any indication, then only we take. So a safer option would be, if the patient has okay already crossed the 5 years or 10 years gap before the last dose, and if the wound is looking quite dirty, don't hesitate to go for tetanus injection. This is the important point. Now, there is a case scenario for you. Okay, so I'll probably mention this case scenario in your homework. It is very easy. Just go through this case scenario and then choose a correct answer. So let me stop here now.